Hi, Ultimate Wellness Tribe. Today I'm joined by the incredible Cynthia Thurlow. Cynthia is a nurse practitioner, host of the Everyday Wellness podcast, author, and international speaker. She is globally recognized expert in perimenopause, menopause, and intermittent fasting. We are honored to have Cynthia Thurlow as a keynote speaker at our annual Ultimate Wellness Conference at Faena Forum in Miami Beach on September 26th through 28th. And at our conference, Cynthia will deliver her empowering keynote, Menopause, Hormones, and the Microbiome, Women's Health. So please join us, meet Cynthia in person, and be empowered and inspired by her and over 30 experts on health optimization and longevity. Now you can purchase your ticket with the promo code Cynthia at the ultimatewellness.miami/forum. Hi, Cynthia. Thank you for joining the conference. Thank you for supporting us. And thank you for joining me today. I have prepared a few questions to you.
Well, wonderful. It's so nice to connect with you and really looking forward to speaking in September with so many of my friends and colleagues as well.
And we will have amazing panel discussion on women health and some well-known speakers such as J.J. Birchin, Dr. Amy B. Killen, Dr. Wanda Wright, and some other powerful women. Yeah, so definitely this is the conference to attend. Now, Cynthia, you have been in health and wellness space for over 25 years. How your focus evolved? Was it originally focused on women health and intermittent fasting and intersection of hormones and microbiome?
And so 9 years ago, I left traditional allopathic medicine to kind of create my own practice. And really for the last 9 years have laser focused on women in perimenopause and menopause. And actually, my first TEDx talk was on perimenopause, which at the time there wasn't a lot of focus on that transitional period. And so I would say over the last 10 to 15 years, intermittent fasting has been part of many strategies that I discuss with patients, but that's actually probably what I'm best known for, but it's a strategy that works for a lot of people, maybe not everyone. And then the gut microbiome has been something I focused on over the last 9 years, again, because I kept seeing trends with my middle-aged patients, looking at stool samples and food sensitivities, that it became apparent to me that something was changing with our immune health along with those sex hormones. And so I always say, life imitates art, and it allows me to be a little kinder to myself and allow women to understand that there's a lot of different ways to navigate this transitional period.
And any final words of encouragement for women who is in their midlife and they feel like they're just getting started? What is the main suggestion? Where to start?
Yeah, I would say number one, I tend to be like a sponge. So whether it's a book or it is listening to a podcast, I would just get informed and educated about the way your body is changing at this time in your life. I remind women that we're not designed to just survive. We're designed to thrive in this stage of our lives. And so it's all about finding an empowering community of women to interact with. I think it's also really important to work with practitioners, whether it's an NP, a physician, a PA, working with providers that are knowledgeable about this stage of your life to help you navigate choices. And choices could be like the lifestyle piece that we talked about, or targeted supplements, or even medication like hormones. And the biggest thing that I would say that I wish I knew 10 years ago that I know now is that I should have started hormone replacement therapy a whole lot earlier. And I just didn't know any better. So I oftentimes will say to women, you will know when you are ready, because you will find that whether it's the sleep or the stress you can't manage anymore, or you become weight loss resistant, it's your body's way of just telling you that something is not properly balanced. And I can assure everyone that more often than not, when women are seen and heard and they are able to take action, amazing things happen. Our generation is not going to allow women to feel like they just are just surviving for the rest of their lives. We really do want women to spend, that last third of their lives really thriving and vibrant and healthy, and, not experiencing symptoms, if at all, and certainly having loving, healthy relationships with their loved ones, their family, their significant other. And I'm certainly grateful to have the opportunity to speak to this community.
Yeah, sounds like this hormone optimization is the tool to reclaim our power at midlife. And also, many coaches consider this as an elixir for longevity. We will have such a topic at our conference, and we will dive deep into this approach.